Dr. Krishna Reddy, Regional Director for Access Health. COVID experience, COVID shock the world is going through actually. The global health governance system, dominantly represented by the multilateral bodies under the aegis of United Nations, including the World Health Assembly, and many other non-state actors which are operating out of the global health ecosystem, which includes the think tanks, which includes the donors, includes civil society organizations, the private sector, and other media and other representatives. So as a part of that, there have been variety of groupings and the discussions, starting with United Nations General Assembly, followed by World Health Assembly. Then we have World Economic Forum, where the private sector was deliberating on these health challenges. Then we had Asia Venture Philanthropic Network, which is basically a grouping of philanthropists, how they can combine their efforts to address some of these health challenges. And more importantly, the powerful groupings of the G7 countries as well as the G20 countries. So all these groupings have been actually pursuing what global health policies will ensure that the world does not face a similar crisis like COVID. Originally, the World Health Assembly actually constituted an independent committee to evaluate overall the response of the World Health Assembly and World Health Organization and also other global health actors during the COVID response and give suggest recommendations. Taking forward those recommendations and also the feedback received from member nations of the WHO, certain proposals were tabled in World Health Assembly, predominantly on mobilizing financial resources to support the low-income and the middle-income countries to strengthen their public health systems so that they prevent the future health emergencies and also they prepare themselves to respond appropriately and absorb the future shocks. G20, with reference to the health, one of the key achievement was the announcement of contributions to the extent of about $1.8 billion as the initial voluntary contribution by some of the member nations of the G20 towards creating that pandemic fund and instituting its operational mechanisms by the World Bank in collaboration with the WHO. There were other issues discussed, initiated in G20 Indonesia, but they are still in the process of dialogue among the nations, which will be carried forward into the Indian presidency as well. And these included the global public goods, that means the non-financial resources required during a health emergency by the underdeveloped or the low-income or the middle-income countries, which includes the vaccines, which includes the drugs, which includes technologies like the ventilators and other things, and some of the digital solutions as well. The third element is how can you may have the public goods, you may have the money, but what is important is the human resources. The health workforce, especially we who have the competencies to handle the public health emergencies, is being carried up from Indonesia deliberations is in terms of the health data. It became very essential that the health data has to be shared within hours and within days, unlike the current protocol under international health regulation, which gives 1 week time. So Indian presidency is continuing forward some of these agenda items which were deliberated in Indonesia, but with specific emphasis on the medical countermeasures, what I called the global public goods, how the country should be enabled to access these essential medical countermeasures like the vaccines and the drugs in an equitable fashion. Some of the suggestions coming forward from the previous Indonesian presidency as well is creating regional manufacturing hubs so that it mitigates the risk of the disruptions, the supply chain disruptions that we are witnessing today, and also the disadvantage of centralizing manufacturing into one or two countries. So if we can decentralize and then create regional hubs so that even if there is a disruption in one location, the entire world need not be suffering because of these disruptions. The second element of these medical countermeasures would be in terms of the intellectual property rights, the patent waivers, and also how the public investment can happen in medical technology and the research so that the intellectual property is made available for the global public good. Similarly, a lot of digital tools which have become equally important in responding to the public health emergencies. There are countries like India has become a member of the Global Public Good Alliance, wherein some of the digital platforms which India has developed in the recent years as a part of India digital mission, especially the digital stack, the India stack, the health stack, they are very revolutionary architectural tools which India is willing to share with the rest of the world as a part of the global public good. So in addition to these three, one of the specific agenda item which I think India is bringing forward is relooking at the traditional medicine and how the traditional medicine can complement the modern medicine, because traditional medicine is strong in health promotion and disease prevention, while the modern medicine is strong in treatment and rehabilitation. So if that means there is a complementary advantage of both the systems of medicine, what we call the integration of traditional and modern medicine. So this is another policy agenda specifically being articulated by the Indian presidency.